Allogeneic hematopoietic stem cell transplantation is a widely used treatment for leukemia and other bone marrow disorders. In patients who receive this therapy, chronic graft-versus-host disease is a leading cause of late morbidity and mortality. Researchers hypothesized that giving anti-human T lymphocyte immunoglobulin, or ATG, as part of preparation for transplantation would decrease chronic graft-versus-host disease. But would it result in more infections and relapses? In this prospective multicenter study in patients with acute leukemia, 161 participants were randomly assigned either to the standard myeloablative regimen or to the same regimen plus ATG at a dose of 10 milligrams per kilogram of body weight for 3 days before undergoing allogeneic peripheral blood stem cell transplantation from an HLA identical sibling. After 24 months, the incidence of chronic graft-versus-host disease was 68.7% in the standard regimen group and 32.2% in the ATG group. The groups were similar in rates of relapse, infectious complications, and overall survival. The fact that relapses and infections were not increased with ATG was a happy surprise, since it was thought that reducing T cells with ATG might also lessen graft-versus-tumor effects and make the patients more susceptible to infection. The authors conclude that the addition of ATG to the standard myeloablative regimen before allogeneic transplantation resulted in a significant reduction in chronic graft-versus-host disease without increasing infections or relapses. Full trial results are available at nejm.org.
As you learn about or plan for a blood or marrow transplant, your transplant team will help you learn about GVHD. GVHD stands for graft-versus-host disease. Learning about GVHD and knowing the signs and symptoms to watch for can help you be more prepared for your transplant recovery. What is GVHD? GVHD is a common side effect of an allogeneic transplant. An allogeneic transplant uses healthy blood-forming cells, also called stem cells, donated by someone else. GVHD develops when your new donated cells do not recognize your body, and as a result, your body is attacked by your new cells. GVHD can range from mild to severe, or in some cases, it can be life-threatening. GVHD may be temporary, or it may be a disease that you continue to have long after transplant. If you develop GVHD, your doctors will provide treatment and help ease your symptoms. There are things you can do to lower your chances of developing GVHD. The first tip is to take your prescribed medicines and to continue taking them even if you feel healthy. The second tip is to be alert for any warning signs and tell your doctor about any changes in your body that you see or feel. Your transplant team will give you a list of signs and symptoms to watch for. Sometimes primary care doctors or hematology-oncology specialists may not know the symptoms of GVHD. It's important for all your doctors and transplant team to talk to each other and share information about your health. If you're concerned about a new symptom, it's okay to ask your doctors to check in with each other. Your health is their top concern. The third tip is to avoid exposure to the sun. The sun's UV rays may trigger GVHD or make it worse. If you go out, make sure you always wear a hat, sunglasses, long sleeves, and pants. Also apply SPF 50 sunscreen to all exposed skin. You may also want to wear SPF clothing for added protection. And always remember that the sun on a cool and cloudy day can be just as damaging as on a hot and sunny day. The treatment for GVHD works well for many patients. However, you may need to be treated for weeks or months. This is because it can take time to find the best medicines for you with the fewest side effects. While GVHD is serious, there are treatment options, and early detection is very important. If you have questions about GVHD, talk to your transplant team, who together with Be the Match will be there to guide and support you every step of your transplant journey.
Hello, my name is Dr. Shahrukh Hashmi. I'm a consultant here at the Mayo Clinic Transplant Center and also the director of the long-term follow-up clinic here within the blood and marrow transplant division. Graft-versus-host disease is a rare disease. It happens as a complication of bone marrow transplantation, which is equivalent to stem cell transplantation. What happens is that the immune cells of the donor, they recognize your body as a foreign tissue, a foreign organ, and they reject your body. What causes this? What are the risk factors? It's very complicated. Briefly, few risk factors we recognize include a gender mismatch. For example, if the donor is a female and the patient is male, that can cause an increased risk of graft-versus-host disease. And then certain genetic matches which are important for transplant, if they're not perfect, they can cause graft-versus-host disease as well. There are different types of graft-versus-host disease with different presentations. There's the acute graft-versus-host disease, which happens within few months of transplant. There's a chronic graft-versus-host disease that happens after a few months of transplant. It can happen after 1 year or even 2 years of transplant. And then there is a new category called overlap type of graft-versus-host disease, which has features of both acute and chronic graft-versus-host disease. The acute graft-versus-host disease, which can happen within few days, few weeks, or within, for example, 3 to 4 months of transplant, usually presents with the involvement of the skin, the GI tract, or the liver. Now, the chronic graft-versus-host disease is a unique disease that happens as a late complication of transplant and resembles a disease known as lupus. It can affect any organ system. For example, it can affect the eyes. Patients can have very dry eyes, which can lead to blindness. It can affect the mouth, causing dry mouth, difficulty in swallowing. It can affect the GI tract, cause persistent nausea, vomiting, diarrhea. It can affect the liver. It can cause scarring in the liver. It can affect the skin, sometimes, which can cause shiny skin or plaques on the skin, sometimes the joints.